Yeah, so IMBRAVE 150 has been a pivotal trial in advanced HCC. So previously in November in ESMO Asia, what was demonstrated was that for patients that were randomized to treatment with atezolizumab plus bevacizumab, they had an improvement in both progression-free survival as well as overall survival compared to sorafenib in the first-line setting for advanced HCC. So here at GI ASCO, it's really kind of building upon the survival data. Now we're really focusing on patient-reported outcomes, and I think this is absolutely vital since our patients are at the heart of this disease. And what was presented was really looking at the differences between those patients that were treated with atezolizumab plus bevacizumab versus sorafenib in terms of time to deterioration of numerous patient-reported outcomes, including quality of life, physical functioning, as well as role functioning. And what was shown was that in terms of quality of life, there was a statistically significant difference in terms of time to deterioration of quality of life between those patients that were treated with atezolizumab plus bevacizumab versus sorafenib, really favoring atezolizumab and bevacizumab. The time to deterioration in terms of median was about 11.2 months for the patients that were treated with combination immunotherapy with bevacizumab compared to sorafenib, which was only about 3.6 months. Similarly for role functioning as well as physical functioning, and a lot of this has to do with kind of your activities of daily living, time to deterioration was also statistically significantly delayed for those patients that were treated with atezo plus bev versus sorafenib. Similarly for symptoms, whether it was fatigue or pain, all the patients had a delay in terms of deterioration of those symptoms when they were treated with atezo plus bevacizumab versus sorafenib. So everything is really kind of making sense. It's really showing us that this treatment is really working as a frontline treatment for patients with advanced HCC, and patients are actually tolerating this treatment, and as a result of that, their outcomes in terms of their own patient-reported outcomes, in terms of a delay for deterioration for quality of life as well as symptoms, as well as physical functioning, all of those are delayed in favor of atezolizumab and bevacizumab.